The CARE Act, supported by AARP, was enacted into law in New Jersey in 2015.
Caregiving requires an enormous amount of commitment, consistency, love. Caregiving is required when there's a shift in somebody's health and well-being. For me, there was a shift with my dad, so I became the person who oversees all the medical care and the conversations with the doctors, coordinating with the doctors, making sure that my dad has everything that he needs so that he's at his maximum comfort and at his maximum health. It's a commitment that can't be walked away from. It can't be the kind of thing that you say, oh, you know what, I'm not really in the mood to deal with that today, so I'm just going to ignore it. It does require an enormous amount of rigor, and it's a real labor of love.
The purpose of the CARE Act is to have hospitals include the caregiver in care planning. Provision 1, Designation. Record the name of the family caregiver upon admission into the facility. Provision 2, Notification. Contact the family caregiver prior to discharge to another facility or home. Provision 3, Training. The hospital gives the caregiver the opportunity to receive instruction on all aftercare tasks included in the discharge plan. The caregiver gets the opportunity to ask questions. Provision 4, Consultation. The hospital consults with the caregiver on the discharge plan, taking into account the caregiver's capabilities and limitations. The discharge plan includes contact information for necessary health and community resources. AARP's advocacy revolves around the family caregiver. We are focused on gaining the support of state government, healthcare providers, and the public.
The biggest difference that happened with the hospital stays for my dad was a plan. That was always the buzzword. What is the plan? Because going ahead, we had to figure out, okay, so now we have dad coming home, now what do we do? So it was really helpful to be able to talk to the doctors, figure out what was required, what we needed to do, how we needed to follow up to really prevent any problems happening in the future so that we would not have to go back to the hospital. AARP has been incredible in getting legislation to the states to make this happen because, truthfully, I don't think I would have been able to get through this without this kind of support.
I would like to thank AARP
for supporting the CARE Act.
You've made an incredible difference, and we appreciate everything you've done for us. Thank you.